Hello, everyone, and thank you so much for joining our presentation today. My name is Patrick Grant, and I am a fifth-year PsyD doctoral candidate pursuing a degree in clinical psychology.
And my name is Kelsey Clark. I am a third year clinical psychology doctoral candidate at Drexel University.
And today we will be providing you with the DBT-based coping ahead skill for individuals who are working in the healthcare field and trying to manage the stress and uncertainty and anxiety around the COVID-19 pandemic.
Mhm. And we would like to thank the Jefferson Center City Clinic for Behavioral Medicine, the Jefferson Department of Psychiatry and Human Behavior, as well as our clinic director, Dr. Virginia O'Hare. And before we start, we also want to extend our thanks to all of the healthcare providers who are working so hard right now in the midst of the pandemic.
Absolutely. And so, again, our learning objective is just to help you all learn how to plan for difficult situations ahead of time and set yourself up for success to cope effectively.
So, what do we mean when we say cope ahead? Like Patrick was just saying, the idea is to figure out, which situations are likely to cause you trouble, and then planning ahead, not just how to cope with those expected difficulties, but also imagining being in that situation and imagining yourself coping effectively. I think Patrick has a really good example of what this is like.
Yeah, I sure do. So it's kind of like if you're having an interpersonal situation, an interpersonal challenge, an argument with like a friend, a partner, what have you. And you're in the shower and you're just thinking about the next time you're going to see that person. And you really plan out, okay, I'm going to say this, I'm going to respond this way, I'm probably going to initiate the next conversation. It really, we cope ahead from day to day, but now we're just making that coping ahead skill relevant to the current pandemic.
Mhm.
Now, this is when we're going to talk about when you want to use coping ahead. So, coping ahead, as we mentioned with the interpersonal conflict, it's useful for many situations, but specifically, it's useful when you're feeling afraid or worried, or when you're in kind of a new or uncertain situation. And that is basically this situation that we're in currently right now, the COVID-19 pandemic. It's new, it's uncertain, and it's really making a lot of people feel afraid and worried, especially those who still have to show up to work, like healthcare providers. Coping ahead is also useful when you know that your emotions are going to be so high that they impede functioning. Also, when you have difficult urges. So, with this new kind of uncertain epidemic, this new and uncertain pandemic that's going around, it's really causing a lot of people to feel extremely anxious and extremely emotional to the point where if you're a healthcare worker and you have to show up for work, it may be hard to complete the task of your job, right? And it may also cause you to have some difficult urges, such as using all of your PTO time, possibly not showing up for work, possibly, who knows, any urges that may be maladaptive in this situation.
Well, so bearing all that in mind, how do we actually cope ahead?
Well, the first two ways, Kelsey, are to describe and decide, right? So the first thing you want to do is describe the problem, describe the situation that you are really worried about happening. Right. And then in describing that problem, you want to be specific. You don't just want to say, I'm afraid of going to work. That's not a specific problem. What are you exactly afraid of? Well, Patrick, I'm afraid of showing up, interacting with someone, and then contracting the virus, right?
Mhm.
And then after you have described the situation that you're worried about happening, you really want to check the facts, right? So many times when we're faced with a novel situation, we can get really afraid and we can get hijacked by our thoughts, right? And sometimes we can entertain thoughts that may not actually be problems if they were to happen. So you want to check the facts with the situation that's causing you worry, and really highlight whether or not it'll be an issue if it actually happens. So then after you describe the problem and then after you check the facts, you want to go ahead and name the emotions that you feel when you think about that situation or when you think about those facts, right? And you really want to be intentional about naming the emotion and not naming the thought. So especially in times like this, someone may ask you, well, what do you feel about COVID-19? And you may go right on into, well, I think that we should do this. Or what do you think about going to work during this time? Well, I think that they should put in place rules for XYZ, right? We're not asking for what you think, but we're really asking for how you feel. And so Kelsey and I put in two resources that really provide emotional language and emotional vocabulary so that when you describe the problem situation and when you check the facts, you can tap into those resources to really identify how you feel. After you describe the problem, check the facts, name your emotions, then you want to decide what coping skills you want to address the problem. So at this point, you've already specifically identified the problem. And so now you can be just as specific about how you're going to address that problem, right? So that could be, okay, I'm going to use some of my DBT distress tolerance skills, which some of our peers are going to talk about in another video. Or that could be, I'm going to write out a plan for when I go to work, which could include collaborating with my supervisor, collaborating with my coworkers to really create a safe environment. Or I'm going to create a plan with my family, right? You want to be you want to decide what coping skills that you want to use and what actions you're going to take to specifically address the specific problem.
Mhm. The next steps after that are to imagine and rehearse. So we need to imagine ourselves being in the situation and imagine that as vividly as possible. And we want to do this, sort of speaking in the present tense. So it might be something like, I am walking into the room of a COVID-19 patient, or I am speaking with a patient's family member and delivering bad news, or I am at home and hearing that a colleague of mine has gotten sick. So thinking again of those specific situations and imagining them vividly. And then once you've done that, then we need to rehearse. So rehearse exactly how we would cope effectively. So this might be, imagining what you would do, like, okay, I'm at work and there isn't enough personal protective equipment. So then I, use an alternative material, or then I, bring the concern to the attention of administration. Um, and so then once you have done this, you can also work on rehearsing, what might happen if you were faced with a new problem you hadn't coped ahead for. So what are sort of contingency plans or things that you could have in place to cope with new problems that arise? And it can also be helpful to think of the most feared catastrophe. So what is the worst case scenario, and actually thinking about in some detail what that would look like and how you would cope with that if that were to occur. And the idea with this too is to be intentional. So we don't want this to turn into an exercise where we are then ruminating and thinking about millions and millions of examples and getting more and more anxious, and having this just go on for an extended period of time. We want this to be something that is specific and is targeted in order to be a coping skill in and of itself.
And then, so after you've described the problem, after you decided on the coping skills that you're going to need to address the problem, after you have imagined and after you've rehearsed, then you get to relax, right? We recognize that thinking about the worst possible scenario or thinking about a situation that you're worried about is an exposure, right? You're not only exposing yourself to thoughts of the situation, but you're also exposing yourself to the thoughts and emotions that come along with that. And that can be kind of overwhelming. So after all of that, we want to encourage you to engage in some relaxation techniques. Some may be more therapeutic, where it could be 4-2-6 breathing, where you breathe in slowly with 4 counts through your nose, hold for 2 counts, and then exhale for 6 counts slowly through your mouth. Or they could be more I don't want to say non-therapeutic, but just more enjoyable, right? Like lighting some Palo Santo, kind of like stimulating your senses through smell, eating some chocolate, drinking some wine, spending some time with family, right? A more enjoyable relaxation method. So anything that relaxes you, we want to encourage you to engage in after you've coped ahead.
Mhm. So let's bring this all together with an example. So let's imagine, Joe is someone who is going to sing a solo at a choir recital. And he's really nervous because he's never had a solo before. And then on top of that, he's recently had laryngitis. And so he's really feeling afraid that when he sings a solo, his voice is going to give out. Um, and so first he tries imagining, singing and, having no troubles at all. So kind of imagining the best case scenario, which does help. It gives him some confidence, but he's still feeling anxious. So then he decides to use the cope ahead skill. Then he practices in his mind, okay, I'm walking on stage. I am, putting down a glass of water that I brought with me. I'm going to put it on the floor. And then he imagines starting his performance and then suddenly his voice going out. Then he imagines bending over, grabbing a glass of water, drinking some water, and then returning to finish his song. And so this is actually based on a real life example written by Dr. Marsha Linehan, who developed DBT, Dialectical Behavior Therapy, like we mentioned earlier. And this is, based on an example of someone that she knew who used this skill and then was able to cope ahead and then, had a performance that went off very well. And I think that this really highlights, the intention behind coping ahead. So Joe was able to practice and plan and rehearse all the skills that we just described. And then he was able to, be prepared for this performance because he had coped ahead.
And so we just wanted to leave you with some take home messages from this presentation. So we really want to encourage you to cope ahead with any event during this pandemic that causes you stress, anger, anxiety, fear, any extreme emotion that could impede your functioning at work. We want to encourage you to imagine experiencing what you don't want to happen, right? So that exposure piece. Rehearse in your mind what you would do if you were faced with that situation. And just like Kelsey said, you don't just want to like think of every single thing, ruminate, and then get out of control. But you really want to do this intentionally and make specific plans, right? So specifically focus on one situation and then focus on like a specific way to address that situation. And then we also want to make note that this COVID-19 is super uncertain, and there are a lot of things that are outside of our control, right? We want to encourage you not to focus on those things that are outside of our control, but to really focus on the things that are and try to control those as much as possible. Not really have a rigid grasp on it, but address them as you see fit, as a way to kind of manage your stress and anxiety.
Mhm.
Mhm.
And so here we have some additional resources so that you can learn more about this skill and also learn about other kinds of skills and information that's specifically directed at healthcare professionals who may be interested in these services.
And if you feel that your efforts to kind of manage your stress and anxiety are not as effective in this moment, and you feel that you are at risk of harming yourself or others, we also wanted to provide resources from the NAMI Philly Warm Line, as well as the National Suicide Hotline, as well as 911.
Mhm. So we want to say thank you again to the Jefferson Center City Clinic for Behavioral Medicine and the Department of Psychiatry and Human Behavior. Thank you again to our clinic director, Dr. Virginia O'Hare. And we want to extend our gratitude once again for all of the healthcare providers, all of the staff and individuals who are working very hard to take care of our communities during this health crisis.
Yes,
So thank
thank
you.
you very much.